Hi, Christina. All right. Hi, Mitney. I'm doing great. Thank you for asking. Okay, I'm frozen on here. Hi, Jamie. Thank you for all the blue hearts. Are y'all excited about tonight's book review? I'm very excited. I have been looking forward to this all week long. So, I hope that I will have lots and lots of participation by lots and lots of questions about this book. Because the only way you're going to learn is if you ask questions. Now is the time to ask questions. Now is the time. No one can see you. No one knows what you look like unless you know somebody else is watching this as well. But no one knows what you're looking like. So by all means, if you have a question about this book, okay, about this book, please ask tonight, because that is why we're doing this book review. This is a very good book. And I hope that you have had the time to go over it. If you haven't, that's okay too. You can obviously go over it as we're all going over it. I don't think this is going to be the last time I will be doing something like this, because it's so exciting. I have been excited all day long. I've been telling everybody about it. So, all right. Hi, Rebecca. Thank you for all the blue hearts. Hi, Alani. Christina, when you get a chance, I want to ask you about one of the questions I think is a mistake. We will get to that. Hi, Amanda. Thank you so much for joining me. Hi, Shannon. Yes, it's fun time. Thank you for all the cards. Hi, Ellie. Hi, Blue. I've been waiting for this all day. Me too. Christina, I love it. Yes, I love it too. Ellie, ready to flip my book with you. Excited. Good. Alive in my 50s. Hi, Blue. I'm excited about the book without the book. Oh, no. But thank you for being here anyway. Thank you for all the blue hearts. Hopefully, this will help you to learn a few things too. Okay. Hi, Zaida. Thank you for joining me all the way from California. Hi, Liliana. Hey, girl. Hey. I love that. I used to do that to my friend Jessica, because we used to talk after work. When I worked from 6 to 2:30, I would call her, and I would always talk to her at first like, hey, girl. Hey. Her daughter would hear it, and she was little at the time, and so she would say, big girl, hey, because that's what she heard. But it's so cute. Hi, Dina. Thank you for joining me. All right, so let's go ahead and get started. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Tonight, for all of us book lovers and self-proclaimed nerds, we are going to be reviewing this book. So this is a handy-dandy little book that was brought to my attention by one of the viewers. One of my other viewers ordered it, and of course, highly recommended it. So I checked it out, and of course, I went bonkers because it is such a great value for all the questions that it's asking. Now, this book says it's 600 plus questions for the CPC exam. Now, if you're not familiar, the CPC exam covers all of the outpatient setting. Now, this book is also good if you are going to be sitting for one of the AHIMA exams, because all of the AHIMA exams that are the CCS, the CCA, and the CCS-P all cover outpatient coding as well. The CCS-P covers only the outpatient side. The CCA and the CCS both cover inpatient and outpatient. So this is still a really good study book to go over. It's got a little bit of everything. It's got a smattering of medical terminology and anatomy, which is what I really like, in conjunction with the coding questions. Now, it is just about the CPT side. It does have some diagnosis codes in here. The E&M section in here, I will say, was not updated to the new way of coding for E&M. So there's a few errors. There's quite a few errors in the E&M section. So hopefully you understand, you got that part. Now, here's the thing. So here's the thing with this. Yes, this book does have errors, but I do want to say this. What better way to learn critical thinking? Well, Blue, why would I want to learn from a book that has errors in it? So I caught roughly about 10, okay, that I caught in here. But that does not discount the rest of the information that is in this book, plus it has the rationale. Now, the thing with the errors that I found in this book was sometimes the codes had been updated, so the codes that they have in here were already deleted. You have to keep in mind, I don't know who this was actually written by. It may have been written by a group of people who came up with questions and things like that. So it doesn't have your stereotypical author, this person, this person, this person. It just says it's by dynamic path. And so for the whole part of it, even when you do find an error, it's because you looked in your book and you were able to compare it to this, and you're like, wait a second, no, it's actually this code. That promotes critical thinking. Now, if I'm going to get into my QVC frame of mind, that, friends, is going to help you to learn what wonderful things come from this little pink book. Or for you men, it is salmon colored maybe. But from this little pink book, you can learn so much about like really looking at what you're looking at here. So it's forcing you to get that critical thinking, that critical eye, so that you're not missing details. Now, tell me what other book does that? And for the value that this book is, only $14 on Amazon. Now, this was never meant to be an ad. This isn't even an ad. These people don't know me. And I did leave the link for my Amazon affiliate. You don't have to click on it. You see the title, you can look for it yourself. But when it comes to what the information as a whole that you can find in here is really amazing. So I hope that this helps you to continue to study, because again, when you are looking at these questions and how they are written, they're not all written those one-liner questions. They're written in like little paragraph form. Again, what better way to prepare you for an exam? Whether you're sitting for an AHEMA exam or an AAPC exam, they're designed to ask you questions in order to make you think. Again, this book does just that with their little paragraphs. And some, I was so surprised to see their procedure notes. I was like, this is pretty good. But then when I looked at some of the other questions, I was like, okay, I see where there's a hole in this documentation. It could have been a query or, somebody from CDI to come in and help them out. But again, that's helping me to get that sharper eye. Like, okay, if they did it like this is something I need to watch out for in the future. So, Liana, I'm so sorry. My cat just walked on my keyboard. They wanted to say hello too. That is totally fine. We love cats. I love cats. Christina, the questions are great and seem easier than the AAPC book questions. Live in my 50s. Oops, still here trying to connect you to my TV. On the big screen. Liliana, that's what I came here for. The QVC. CB, yes. Hi, Blue. Hi, CB. Thank you for joining me. Dana, my cat just clicked out of the live stream. Bad cat. All right, so that being said, who has the opening question? Christina, I know you wanted to ask me about an error that you found. Please let us know. What did you see? What page are you on? And if you have a question, anybody in the audience, if you have a question, let me know the page and let me know the number so we can flip to it as well. Page 99. Okay. Going straight for the jugular. Page 99. We are in, what are we in here? Diagnosis coding. Okay. Number 19. A 26-year-old man has been diagnosed with Crohn's disease of the large and small intestine without complications. What is the correct code for the diagnosis? Okay, so what is your question, Christina? I'm going to see what it has in here in the book. And fix. All right, here we go. So 19. So the answer they have is K50.8 is the correct code for Crohn's disease of both small and large intestines without complications. I saw the answer was K5080. And according to the description, they are saying K50.8. So is it K5080? They just may have forgotten the 0. Let's see. If it's just a typo like that, then you know it's a typo. Let's see. What does the book say? KLM. Hi, Tangela. Thank you for joining me. K50.8. Yep. K50.80. So it's just a typo. Again, that's just working on your sharpening your attention to detail skills. I don't know why I always move my pen, but yeah. That was just a typo on that one. Sometimes the O is left off. And you know, that wasn't the first one that I caught with a 0 off of there. So yeah, it could have been just that. Maybe when they were printing it, they thought that the 0 didn't count or something. So yeah, half of these codes look wrong anyway. But yeah, so that answers that one. It means the same code. All right, so next question. Who else had a question? Come on. I told y'all don't get quiet on me. Okay, well, while I'm waiting for somebody to give me a question, I will point out one that I caught. It was in, okay, musculoskeletal. No, you're not. All right, so there was a couple. Okay, so if you flip to page 11, this is the one that I found. So, number 9 on there, it says, the patient returned to the office 1 month later for removal of a cast from her lower arm. The original attending removed the cast. The physician also examined the arm and determined that there was no further casting or follow-up was necessary. What is the appropriate code for this service? Does anybody know? No? Okay, so this was a part 2 to the number 8 question, which was that the girl had been riding her bicycle on the side of the road when a large dog ran out in front of her and forced her to crash into a drainage ditch. The patient hit her left arm on the cement drain pipe, suffering an oblique fracture of her left radius. The fracture was set with manipulation of the radial shaft. The arm was then casted in the usual fashion. The patient tolerated the procedure well and was asked to return to the office in 1 month for follow-up, x-ray, and removal of the cast. How would you code for the fracture repair? Okay, but then for number 9, it says the patient returned to the office 1 month later. So she's 30 days into the casting. Remember, she had a casting. So when we think about casting, right? Castings for like a closed treatment with manipulation, even closed treatment without manipulation of a fracture is going to be a 90-day global procedure. So what that means is for the next 90 days, all of those visits are covered, right? Because that it's just a normal part of taking care of the patient. Now, yes, they didn't go up to the OR, but because it's considered a major procedure with a 90-day global period on it, all of the subsequent visits are going to have that fracture code with a D for the healing, as long as it is healing normally. And then you're going to be coding for the procedure code, which is either a cast change, but in this instance, they didn't have that. So you would report 99024, which is a CPT code that you use during the post-op global period. That 99024 says that that visit is part of the global package. So there are no, it's not going to charge anything, right? Because it's like a placeholder, you know, if you will. Instead of like an E&M, they're going to get the 99024 because they're going to say that that's already been paid for when we paid for this global period in the beginning for this treatment. Dina, I don't have this book. I've been reading out of the Optum E&M Advisor today. Oh, good. Liliana, was there a challenging portion or a portion you would point out just for someone to focus on more? Oh, CB, I got it via Kindle. That's awesome. There wasn't really a challenge for me other than the fact that when I saw the errors, I was like, okay, I got to make sure that I write that down. Because I've seen a lot of these before in my time as, in coding. So it wasn't that bad. What kind of shocked me though was my rustiness on some of the anatomy questions. I did suffer a little bit there. But for the most part, it was just a good reminder of a lot of the things that I was just like, oh yeah, and just being able to look at those different procedures. So hi Sarah, thank you for the blue hearts. Hi Blue, I got my prep ICD book. It is incredibly helpful. Okay, good. So does anybody have any questions? I keep asking y'all for questions. I know when y'all looked at the book, y'all had to have something in mind, right? Was there something that you saw that didn't make sense, or you saw the answer besides a typo that you're kind of curious about? Because I got that one. So 99024, and that's actually not an option here in this book. So for number 9, it says the correct code or the correct answer would be C, which is no code would be reported. That's not true. 99024 would be the CPT code that would be reported for this visit, because it's your 30 days from that initial casting. So you're still in the global period. Even if they're not going to recast them again, that visit is not out of the global period. It's still within the global period. So it falls under that 99024. Okay. Another one that I found was number 19 on page 13. So a 56-year-old man undergoes percutaneous vertebroplasty with vertebral augmentation to L2 to L3 with unilateral injection. What is the correct CPT code for this procedure? So the code that it gave, I believe, was for lumbosacral. Let me pull up the answer. All right, number 19. Okay, yeah. So they said that the correct answer was 22511 is correct because it is for the lumbosacral percutaneous vertebroplasty of one vertebral body. But if you look at the location of the vertebroplasty with vertebral augmentation, it is from L2 to L3. So they're just saying they're in the lumbar section. They're not in the lumbosacral section. They're in the lumbar section. So, if they had said, anything in the L and then plus the S1, then you would have been looking at lumbosacral. But because they were not doing that, the correct answer is actually 22514, which is just for the lumbar only. So when you look in your CPT manual, if you're still using the 21 edition, now we just haven't gotten our 2022s yet at the hospital because they've already uploaded the 2022 codes in 3M. So we typically get the books afterward. Don't ask me. I don't know, but 22514, if you're using the 2021 edition, is on page 156, and so that's percutaneous vertebral augmentation, including cavity creation, fracture reduction, and bone biopsy included when performed using mechanical device, e.g. kyphoplasty, one vertebral body, unilateral or bilateral cannulation, inclusive of imaging guidance, thoracic. Well, that one is for thoracic, that 22513, but because we are looking at the lumbar, then we are looking at 22514. Okay. Christina. Yeah. Yeah, that was a oops on their part. So again, and it could have been just fatigue, but even in the best of books, you're going to find where they have updates, or they're going to have supplements to say, oh yeah, we have to correct this error, whatever. So that's going to happen any book that you get. And even with the CPT, there's things that they have to add too as well. So there's a lot of things, because these are written by human beings. there's going to be errors. And plus these codes get updated and they get changed. And sometimes the rules change too. So that's another thing to kind of keep in mind. But yeah, so that was that one. Let's see, what else did I get? And then there was a typo in procedure 4, number 4, on page 10. They said L4 to L2. Actually, I think they mean L4 to L5, because it's kind of hard. L4 to L2, really. Liliana, even the most seasoned coders make mistakes. That's why there are denials, and sometimes even the insurance is wrong. Yes, and sometimes the insurance will just deny it just to deny it, just to see if they will actually send it back, you know. So yeah, there is always that. Everybody's learning style is different, and everybody's background is different. I do not have the same background as everybody else, and everybody else does not have the same background as me. So it really all depends on the individual, which is why even looking at books like these with some of these errors is going to help you, because then it's going to make you question and look up and verify, and that is a perfect training for a coder, because you're not going to have everything handed to you on a silver platter. You actually have to work for it. Barkeisha, so would you use the add-on code 22515 also? No, because it's only one. It was only one vertebral body. So if they had two, if they went and put 2 in, then yes, absolutely, you would add that that add-on code, that 22515. Each additional thoracic or lumbar vertebral body lists separately in addition to the code for the primary procedure. So yes, and then it says right there, the note that says use 22515 in conjunction with 22513 or 22514. So that would be your add-on code if you were having multiple sections taken care of. So, you got that one? Okay, good. All right, so, and going backwards. All right, so on page 7, number 15, is a 6-year-old boy was bitten by a dog and sustained multiple lacerations as a result. He has a 5-centimeter laceration on his right lower arm and a 2-centimeter laceration on his left hand, and a 6-centimeter laceration on the right side of his lower cheek. While in the ER, the wounds were flushed. When the patient was sedated, the arm and the hand lacerations were repaired. Intermediate repair was necessary for the facial laceration due to the depth of the wound, and layered closure was performed. The patient was also given a tetanus shot and started on antibiotics, which is typical for like bites and things like that, or even cat scratches. What CPT code would you use for the laceration repairs for this child, and what order is correct? So they have, the correct answer is C, which is, they have 12032 and 12002 with 59 modifier. But check this out. So when you go to your CPT manual and you look at that section, which is an interesting, is an interesting lesson in anatomy. If you're not paying attention, I'm going to show you how easy it can be to mess up a CPT code. So when we flip to intermediate repair, right, because that's what they said that they did to this child's face, right, his cheek, they had to repair it, right? So the code that they said was correct is 12032. So when we look at that, it says repair intermediate wounds of the scalp, axilla, trunk, and or extremities. And then it gives the measurements of 2.6 to 7.5 for that code, that 12032, because they said that the one on his face was 2.6 centimeters. So it falls into that 2.6 to 7.5. Can anybody tell me why that code is wrong? Hi, Hannah. Thank you for joining me. Hi, NC. I currently studying for my ICD CPT final next week. Oh, that's awesome. All right, so does anybody know why that code is incorrect? I'm gonna give y'all time to answer. Okay, Alani, but do you know why 12032 for number 15 is not correct? It doesn't mention the face, maybe? Oh, come on, Andrade. Is it because you can't find them from different locations? No. Try again. Andrade's a little warm, but that's not quite the answer I was looking for. Cheek is a face, okay? All right, Dina, and cheek is a face. So this code, this 12032, it covers what? The face is no, it says that it's an intermediate repair. So we're in the right category, right? But we are not at the right code of Arcacia because it's the arm and the hand. Okay, no. All right. Okay. Intermediate. Okay, yes, it's intermediate. It is an intermediate repair, right? So 12032. So 12032, that code is the intermediate repair, right? But look at the location of the repair. Head. You're getting close there, Dina. Come on. We're at the 50, the 40, the 30. Come on, guys. Come on. So it says repair, intermediate, wounds of the scalp, the axilla, the scalp, the axilla, the trunk, or the extremities, excluding hands and feet. 2.6 centimeters to 7.5 centimeters. Scalp. That's why it's wrong. The face is under 12051. You're getting close. You're getting close, Christina. All right. So yes, Sarah, that is why it's wrong, because it says it is of the scalp. It is a intermediate repair of the scalp. We are not looking for a scalp location. We are looking for a face location, right? Because it's his cheek that got the laceration, not his scalp. The scalp is like the forehead back. But that is the scalp, right? So 12050, nope, because 12053, the measurement would be 5.1 centimeters to 7.5 centimeters. And the only one that had an intermediate repair was a facial laceration. 12052, bingo. So, okay, I can see I need to explain this one. I'm glad we talked about this. All right. So when you're looking at the different you have multiple lacerations, right? And when they fall into those categories, right? If we had more than one location, say, for example, we had a laceration on the neck as well, right? Along with the, no, wait, I'll take that back. We had a laceration of the nose and of the cheek. They were both intermediate, right? Then we would add those two together, and then we would come up with that, whatever code it came up to when you add them two together. But because the only thing that was reported with a intermediate repair was of the cheek, that was how, and the cheek was a 2.6 centimeter laceration of the right side of his lower cheek. We know that it is on his face. It is not on his scalp. It is on his face. So we know that that first set of codes under the intermediate skin repair is not correct, because that covers the scalp, the axilla, the trunk, or extremities. The next one is 12041, which is the wounds of the neck, the hands, the feet, or I can't say it because YouTube doesn't like it. But y'all all see in your book, okay? And if you're in the 2021 CPT manual from the AMA, we are on page 104. And then you see 12051, repair intermediate wounds of the face, ears, eyelids, nose, lips, or mucous membranes. 2.5 is, that's where it starts, 2.5 centimeters or less. And then it goes up 2.6 to 5.0 centimeters. And so because the only one that was repaired with intermediate was, because it had to go in a little bit more, was the one of the cheek. That's how you get that 12052. Does that make sense to everybody? Hopefully. So if we can get that first code out of the way, then I'll tell you how I got to the second code. But are we good on that code? On the do y'all get how I got it? So when you're looking at these repair codes for the skin, right, the integumentary system, you are looking at anatomically, where is this? Even though you may be doing a repair of the hands, right, that's not considered extremities when it's broken down in these categories differently, separately, because extremities is covered under 12031, right? And then hands and feet is covered under 12041, and that's where that starts. So, okay, good. So hopefully that makes a little bit more sense. It is about knowing your anatomy, folks, because if if you're not really thinking about it, okay, maybe scalp would fit under that. But when you think about it, it's the face. And part of your face is your cheeks. So that would be why you would have that code. So for that other code, right? But how do we get the other code? So it says, again, it says a 6-year-old boy was bitten by a dog and sustained multiple lacerations as a result. He had a 5-centimeter laceration, right, of his right lower arm, right? And then hold on. Okay, hold on. Okay. So this one, okay, so the boy had 5-centimeter lacerations on his right lower arm, right? So we have 5, and then a 2-centimeter laceration of his left hand. That makes 7, right? And then we've already coded for the 2.6 centimeter laceration of the face. So we have 7-centimeter laceration that was simple because it didn't give us that it was intermediate. It didn't say that it was complex. They're just saying he had this laceration, but one was 5 centimeters, the other one was 2 centimeters. So when it's not given like the depths, you have to be able to tell us how deep did it go, which is why I always get after these providers when they're documenting for skin lacerations or any kind of complex lacerations. If you're going through multiple layers, you need to let us know, because if it's intermediate, then it's like, the subcutaneous and things like that. But you get into the deeper structures down to like the muscle and you're looking at bone. Hey, you got a complex thing there, and there's a total difference between the global periods. And it's very important that they note those layers, because if they don't, then you're going to default to the lowest repair code, which would be the simple. And in this instance, they didn't say anything else about it. So that's why we're going to go ahead and go to the simple, and we're going to add up those 2 sites, which is the hand and the lower arm. So that's 7 centimeters. So that would bring us to 12002. And that's how we got that second code with the 59. Because it's separate. Rochelle says, hi, Blue. Don't have the book, just listening for the knowledge. Thank you for checking in, and thank you for the blue hearts. Yes, Christina, yes. But let me give the rationale as to why we get the 59 as well. Number 15. Way off. All right, 15. And it doesn't tell us why. Oh no, wait a minute. This is the skin. What am I looking in then? Oops. It says 12002 is correct because it must be listed as a second code due to it being less complicated repair. And then it talks about why the other one is incorrect. But the 59 on that one, added to that one, means distinct procedural service. This was completely separate from this intermediate repair. So that's why the 59 was put on there. Do you still add the 59? Yes. Because it's distinct by itself. So. Okay, again, Alani, let's see, page 4 and page 4, question 8. All right, 4, question 8, okay. Options A and B are the same. And so they are. And what does it say that the answer is? Question 8. A. Okay, it just repeated it. I guess they couldn't think of another code to put there, so they put the same code. So if you got A or B, you got it correct because those are the two codes that it says. Let me check something here. Yeah, that's in men. So actually, they may have meant man instead of woman because gynecomastia is a male condition, not a female condition. So gynecomastia is a enlargement of a man's, I can't say it because it's YouTube, guys, usually due to hormone imbalance or hormone therapy. So they probably meant man, right? A 32-year-old man with severe gynecomastia and a prevalent family history of breast cancer, because it does happen in men too. It can happen in men. Elected to have a complete bilateral mastectomy and intermediate insertion. Oh no, actually it's probably a woman, but you see how they did it wrong? So if it was a woman, then yes, that would make sense. But a woman can't suffer from gynecomastia. They can have mastitis, but they can't have gynecomastia because that's a male condition. And it literally says it right here, enlargement of man, right? Due to hormone imbalance or hormone therapy. So yeah, that was written completely wrong. So if you saw that one, yeah, that's written wrong. Definitely written wrong. And see, knowing your medical terminology, you can catch that one too. Because I was like, no, wait, hold on a second. Let me look at that one. That didn't seem right to me. But yes, so Alani, you caught an error, but you also caught a little bit more than that. It's wrong terminology. It is wrong, wrong procedure, wrong everything. So maybe the procedure code is right. I don't know. Let me look. Let me just double check those codes now. 19300. Mastectomy for gynecomastia. Okay, so that is the correct code. And then 19340 is for the implants. So that's for insertion of implants on the same day as a mastectomy. So again, if that was the case, then that would be that. But since that's not the case, you would only code that first code, that 19300 with the 50 modifier, if this is a male. So yes. But yeah, that's the answer on that one. But good catch on that one. And speaking of the 10,000 series, I did have another one. So number 3, on page 3, it says the physician biopsied the skin of a 30-year-old woman's upper eyelid with possible fungal infection. 3 sites were biopsied. How should the physician code for this procedure? These codes, remember, they have been updated. So the correct code is 11102 and 11103 times 2. So that's the updated code, because there is, when you look in the CPT book, you will not see 11100 or 11101. Okay. So while I look for another, Hannah! Y'all, I'm so sorry I'm late. Still organizing and packing and cleaning. Well, you came in, so I'm just glad you're here. The codes for that are deleted, yes. And so the correct code for that, that particular question would be 11102 and 11103 times 2. So, yes, because it's they were biopsied. And see, what happened was they got more specific in the biopsy method. So that's why, these codes, they do get updated on occasion. There's a lot of CPT codes that are the same, right? But there's a lot of CPT codes that get either deleted or they get expanded. And in this instance, it got expanded because they made room for other procedures that were more specified, like on the approach. So for the 11102, when you look in there, where are we at? So 11102, it says tangential biopsy of skin, shave, scoop, saucerize, or curette, single lesion. And then they also have another kind, like the punch biopsy. So they did that kind of biopsy, and then they did the punch biopsy, including simple closure when performed, single lesion. And then that's how it expanded. So these codes were new from the time of this printing. So I think this was printed probably in 2017 or 2018, one of the two. Yes. So as I look through, and I'm going to keep flipping on through, you guys can ask your questions, okay? This is open forum, so you guys can ask questions. Whatever you saw in here that didn't make sense to you, do not just sit idly by and let everybody else do the heavy lifting. You guys have to participate as well, even when you're in these programs. And a lot of times that's where the teachers get frustrated too, is because they don't see like a lot of engagement. So they try to encourage the students to be engaged. Now, I know that sometimes it's hard because it's like, I don't want to ask a stupid question. I hear that a lot. And I hear that from surgeons, and I hear it from PAs. I don't want to ask a stupid question, Blue. There's nothing stupid about the question. If you ask the question, at least if you don't ask it, somebody else might ask it. And so everybody kind of waits for somebody else to ask it. But nobody can see you guys. I'm the only one that you guys can see. This is not like we're in a Zoom meeting where, people are all on camera and then you're asking a question. I can understand being shy then, but this is an open forum and we're all in the chat box. So ask away, guys. This is your perfect time to be anonymous and to say, hey, I don't understand something. I saw this in the book. Can you help me figure it out? Or I don't understand something that you just explained a second ago, Blue. Can you help me out here? Yes. While we were doing this, let me see, what else did I made a note about one other thing. I was afraid of this. No questions, guys. Come on. All right. So E&M. A lot of that E&M section does not apply because, again, it's been updated. And so a lot of those codes, I'm like, but let's see. I'm going to talk about that 57 modifier because they contradicted themselves. In another scenario they had where they did say to use it properly, and then in another one they didn't even use it properly. So let's see. Was it here? You can't be shy when you guys are doing these things, guys. If you don't understand something, you let me know. I'm looking. I hope they update this next year. And you'll see that a lot. Like if you get an edition of a book, it's a lot of times it's not going to be updated. Maybe some of the codes might be updated, but for the most part, that book is going to stay the same for years to come. That's why a lot of these study manuals, like even the prep books, I've told you guys, even if you get a year prior, that's still fine. Because number one, it's cheaper. Number two is it's literally probably got the same codes as the current year. But if you see one that's not the same, then you know that's going to be updated. So let's see. Was it that one? It was the one that there was says to use 57. I'm like, that's wrong. Let's see. Where is it? Maybe it was this one. Ah, yeah, here we go. So the number one question on page 76 for evaluation and management, a 36-year-old woman with a history of multiple complicated ectopic pregnancies presented to her OBGYN office. She took an at-home pregnancy test 2 weeks ago, which was positive, and experienced a heavy during the night last night. So she presented in the morning with complaints of excessive and pain in the abdominal area. After confirmation of pregnancy via urinalysis, the physician performed an examination. After examination, the OB suspected that the pregnancy was ectopic and ordered an ultrasound confirmation. The ultrasound confirmation performed later that day showed an advanced interstitial uterine ectopic pregnancy. The estimated age of the pregnancy was 12 weeks. The OB discussed the risks of the ectopic pregnancy with the patient, who then decided to have an excision of the ectopic pregnancy and a total hysterectomy. The OB spent 45 minutes counseling the patient, and the patient was scheduled for an abdominal hysterectomy in 2 days. Should the OB code for the procedure performed in the office? So it gave you the answers, but I believe they said that the correct answer was B. Or was it C? Let me see. Which one did they say it was? Haha. No. It's not that one. 6,000. Anesthesia. Coding guidelines. Compliance and regulatory. Ah, here we go. So they said it's B. The OB should code for the procedure performed in the office with a 99215 to represent the evaluation and management service. The physician spent over 45 minutes counseling the patient and the decision for surgery, which is indicated by modifier 57. Therefore, the level of the E&M service should be determined on this basis alone. And in this case, this is a level 5 visit. The code 81025 also needs to be included on the claim to indicate that the OB completed a confirmation urinalysis test for pregnancy in the office. The last code that needs to be included on the claim is 76801 for the abdominal ultrasound, which was also performed in the office a day to confirm the ectopic pregnancy status. All right, so can anybody tell me why modifier 57 does not apply? Anybody? I have crickets. I know y'all are out there. I see y'all. I see 26 people out there. Come on. I know somebody just heard me. Does anybody know why modifier 57 does not apply in this situation when they are going to be doing surgery in 2 days? Sarah, I just got my coding handbook with the answers as well, non-resident. Okay. We are shy, Blue. Me coming to you live as a QVC-esque teacher tonight, talking about our favorite little book. Do you need a good book to study with? Well, here you are. And y'all are shy. Come on, guys. Come on. 57. 57 is the 57 modifier. If you look on the inside cover of your CPT manual, 57 modifier is decision for surgery. Same date of service? No. So, okay, I'm gonna read this. I'm gonna read this passage again. Okay, you know what? This is really good because this tells me where people are getting kind of stumbled. Okay, when you are planning for a surgery, if a doctor plans for a surgery, right, and it can be that same day, it can be within 24 hours, it can be within the next week, right? It's affecting their ability to be able to, they have to think about this. So when you have a surgery that is more immediate, meaning that you have it done the same day or within 24 hours, right? I was under place of service code, Sarah. It's okay. I don't have my books with me. Dana! You were just guessing, Christina. That modifier is not the one that modifier is not one of the codes that applies to a modifier. Okay, so you're thinking like it's actually like one of those ones that is meant for the E&M and they try to put it on the procedure code? No. Okay, so I'm gonna go ahead and tell y'all what happened here because we got a quiet audience out there. All right, so let's read this again. A 36-year-old woman with a history of multiple complicated ectopic pregnancies presented to her OBGYN office. She took an at-home pregnancy test 2 weeks ago and it was positive, and she experienced, in the middle of the night, she presented in the morning with complaints of excessive and pain in the abdominal area. After confirmation of the pregnancy via urinalysis, the physician performed a pelvic the examination. The OB suspected a pregnancy was ectopic and ordered the ultrasound confirmation. The ultrasound confirmation performed later that day showed an advanced interstitial uterine ectopic pregnancy. The estimated age of the pregnancy is 12 weeks. The OB discussed the risks of the ectopic pregnancy with the patient, who then decided to have an excision of the ectopic pregnancy and a total hysterectomy. The OB spent 45 minutes counseling the patient, and the patient was scheduled for an abdominal hysterectomy in 2 days. Decision for surgery. All right. 57 means decision for surgery. Now, there is a limited window when we are thinking of applying this modifier to the evaluation and management that you can apply this. So when we look at the appendix of the CPT manual in Appendix A, right? So if you flip to Appendix A, here we go. Decision for surgery. An evaluation and management service that resulted in the initial decision to perform surgery may be identified by adding modifier 57 to the appropriate E&M service. It doesn't go into depth on this one, but the decision for surgery when you're adding modifier 57 has to be done within 24 hours, the same day or within 24 hours. If they're doing the procedure in 2 days, you don't apply that modifier, because you could plan for the surgery and that decision for surgery can be factored into the evaluation and management, but you're not going to get that modifier 57 because it's not done the same day or within 24 hours if you're planning on doing it in a week, right? Or 2 weeks. Let me see what my thing here says. Hopefully it went more in depth on this one than that one. You let me down, Appendix A. Let's see. Come on. Procedures, mandated service. Oh, and if you haven't heard already, you guys know I'm doing my 25 days. 25 days of Vlogmas, all modifiers. I hope y'all tune in for that. Aha! Clinical examples, modifier 57. Where is it? Come on. Well, it says it right here. No, it doesn't. Come on, guys. Modifier 57. It's the same day or within 24. I was trying to read it out like that. Oh, hey, it's okay. The CPT 2022 doesn't show any difference. All right, so let's see. So modifier 57, you add on the same day that the surgery is being performed, a major 90-day global procedure, or within 24 hours. Aha! Thank you, Novitas. You see, Novitas, I love you. I love you. Which, Novitas is another really good resource, you guys, and it is a very reputable resource. All right. So, yes, we're going to accept. Yes, yes, cookie. All right. All right. Modifier 57. What you should know. Yes, I already said. Yes, I accept. Yes, thank you. Yes, 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 yes. Set preference. Thank you. Thank you. Okay, modifier 57 is used to indicate an evaluation and management service resulted in the initial decision to perform surgery either the day before a major surgery, a 90-day global surgery, or the day of a major surgery. So sometimes this can happen. If somebody comes in and they have a broken arm, they decide to go ahead and cast their arm. And they're doing a closed treatment of that arm, like putting a cast on it and things like that. That is a 90-day global service, right? 90-day global procedure. It has a 90-day global package on it, right? So since that is a major surgery, if the patient comes in and the provider decides, okay, you broke your wrist, and we're going to go ahead and put you in a cast. So the provider gets the decision, the evaluation and management service with the decision for surgery, that 57 modifier. Then they also get the closed treatment code, granted that they have the appropriate documentation. So again, Novita says, modifier 57 is used to indicate the evaluation and management service is resulted in the initial decision to perform surgery either the day before a major surgery or the day of a major surgery. So if the doctor says, okay, well, we're going to let your hand swell, your hand swell, you're going to let the swelling go down on your hand a little bit. So next week, we're going to bring you into the OR, okay? That modifier 57 would not go on that visit for that day, okay? Now, you can factor in the decision for surgery into the evaluation and management level, absolutely, because that is a increased risk right there, right? You have to send the patient to surgery and they have to be like put under and that kind of thing. So because they're going to do it next week, that 57 modifier does not go on that evaluation and management code. Okay. because that's saying that there was no major surgery performed that day or within 24 hours. It says appropriate uses. Append only to the E&M procedure code where the decision for surgery was made the day of or the day before a major surgery or E&M during an E&M service. Inappropriate uses. Appending modifier 57 to a surgical procedure code, which I said no. Appending an E&M procedure code performed the same day as a minor surgery. So anything that has a 0 to 10 day global period on it, that's considered minor. Okay. When the decision to perform a minor procedure is done immediately before the service, it is considered a routine preoperative service and is not billable in addition to the procedure. That's another one I'm going to talk about in my modifier series, because a lot of people think, well, I decided to do this and it's a minor procedure that I'm deciding to do. But if you read the rules from CMS, it'll let you know, hey, there's on those minor procedures, it has a component of evaluation and management already built into that code. So yeah, you only get the procedure code. You don't get the evaluation and management unless you're seeing that patient for something else separate. But if the purpose of that visit results in a minor procedure being performed, that is what you're going to get, not an evaluation and management code, if that is the only thing that you are treating and doing in that visit. Okay. But again, more to come on here on the series. So when the decision to perform a minor procedure, okay, no, I read that. Do not report the day of a surgery for a pre-planned or pre-scheduled surgery. So if they're coming in for a pre-op, you're still not going to do modifier 57 on that evaluation and management, okay? If that pre-op is done within 24 hours and it is a pre-planned surgery, that is already considered part of the global package, so you would not get an E&M service for that. So if the patient is coming in the day before their surgery, a planned surgery, it is considered part of the global package and you would not get an evaluation and management for it. Just saying. Do not report on the day of a surgery if the surgical procedure indicates that it indicates performance in multiple sessions or stages. Facts. Global period includes the day before surgery, like I just said, the day of the surgery, and the number of days following the surgery. Note, a major surgery has a 90-day post-operative period, and a minor surgery has either a 0 or a 10-day post-operative period. Preoperative period is the day before the surgery or the day of the surgery, right? E&M service resulting in initial decision to perform major surgery is furnished during post-operative period or another unrelated service. Then the E&M must be billed with both the 24 and 57 modifiers, and that is in a special combination one. It's going to take a little bit more finesse to explain. But let me go ahead and share this page with all of you, so that way you guys can check this out too. What are you, HRI? I just pick any one. It doesn't really matter. Maybe it does because it's like certain regions and certain rules. But they have the little map there. Because Alma says, because the modifier 57 is for the service that resulted in the initial decision to perform the surgery. The jurisdiction for novitas, yeah. So again, it just depends where you're at. Dina, y'all make sure to check the appendixes in the HCPCS book. Explanations are there as well. Good to know. Thanks, Sarah. All right. So there you go. And that's modifier 57 for you guys. So that's when the provider has a patient and they're coming in, and the result of that visit, they're going to be doing a major procedure with something that has a 90-day global period on it, either that day or within 24 hours, then you're going to append that 57 modifier to that evaluation and management code. If they decide to do the surgery 2 days from that visit, you will not get that 57 modifier, okay? Because you can get the decision for surgery, like as far as like when you're adding your components for evaluation and management, yes, but you will not get that 57 modifier. CB says the map doesn't say certain states, which is so strange. It's not that bad, really. All you do is I shared that link. Does it not make it easy for you? I put on here Medicare JH for providers in Arkansas, Colorado, Louisiana, Mississippi, New Mexico, Oklahoma, Texas, and Indian Health and Veterans Affairs. So thank you, Sarah. I'm glad it works. All right. Clear as mud, right, guys? It gets easier, trust me, it gets easier. I do modifier exercises like that all the time on my Patreon channel. Good, awesome. I'm so glad. So glad, Sarah. All right, so but yeah, that was one thing that I saw in here that was wrong, was that 57 modifier. I was like, no. It was in 2 days, and that's something that you have to really kind of watch for. This is why I'm always on my providers. When you decide to do surgery, you know, when are you going to do that surgery? When are you going to do that procedure? When do they have it for scheduled for surgery? So you need to let me know, so that way I know where you are. Because if this is a major procedure, then I'm going to have to be able to count these days, and it's got to show in the documentation. Okay, good, Dina. I'm so glad. All right, so, but yes, that explains 57. So does it, yes, we're good on 57? Do we get it? Do we get 57 now? But this is interesting though, like stuff that I would think that would be so easy. I guess because I've done it, you know, I don't know what is difficult, what is considered difficult for you all. Whereas sometimes I will say a question and everybody will be like, yeah, I know that one. And I'm like, okay, I don't know. So that's why this is a good thing, because knowing what I saw from the skin exercise, like the lacerations, when you're looking at these, the descriptions of these procedure codes, knowing your anatomy and where stuff falls under is very important. You explained it very well. I won't forget it now. Okay, good. I'm so glad. Yay. Oh, thank you. Oh, I'm so glad. All right. So does anybody else have any other ones? Because let's see. I don't think I saw anything else immediate that jumped out at me. But yeah, that's why I say this is such a good book, because it forces you to question. And even when you're looking back at the answers, like 57, I'm like, no, wait, hold on. And then you have that, oh, okay, let me look this up. And while CPT, you let me down, CPT, because you didn't say the same day over the 24 hours like Novitas did. And Novitas is one of those very helpful websites when you're looking and you're trying to understand these very sticky situations. It gives you those examples, right? When are you starting 25 days of modifiers? December 1st. December 1st, I'll be in a full gear. So Vlogmas starts December 1st. For the next 25 days, Vlogmas will be on. Now, here's the thing. I'm gonna do the same thing I did for Christmas in July, right? Which was I released the episode at noon Central Standard Time. So if you are on the West Coast, you're going to be 10. You know, you hear that little ping, especially if you have the notifications bell hooked up. You're going to hear that little ping at 10. Central Standard Time, you're going to hear it at 12. On the East Coast, you're going to hear it at 1. So it's going to be I'm not going to guarantee that all of them are going to be long. You know, I'm going to try to keep them brief so that you guys don't like lose focus. Because here's the thing, the teacher in me struggles to do very short things. And I know that so many people are conditioned now, especially with TikTok and all these little, you know, quick, everybody wants things quick. I don't work quickly, okay? if I feel like if you're going to learn, you're going to take the time to learn, then you need to learn right. You don't need to learn like, oh, this and oh, this and all this and all this. While it may be fast and like, oh, okay, quick, is it going to sink in, right? So sometimes the creativity in me gets the better of me, and I start talking and I start going and I start giving you guys examples. So whether it's 3 minutes or 10 minutes, trust me, I thought about it and that's what I do. So the content that I bring you guys is hopefully that you guys can understand, because I see tonight how 57 caused some people to be like, okay, well, why would that be there? And that's a legitimate question. Why would it be there? Especially when it's all not written the same way, but when you know the rules, you'll know when to apply them. And it is about researching not just your CPT manual, but sites like Novitas and sites like CMS, where they're going to talk more in depth about these things and about the global period and what is considered in the global package and all those types of things. So that's why it's so important to go through your books, guys. I can't like reiterate that enough. I mean, so you make it some shorter videos some days, you make it 10-minute videos some days, you make it a 3-minute video. It really all depends. But for 25 days, I will be talking about modifiers and they'll be, you know, titled out there. So I'm not going to release the dates of what modifier goes when, because that's just part of the process, guys. I will release it probably the night before or the morning of, let you know which one is coming up next. And so I hope that you guys all check them out, because again, a lot of research goes into them. I'm going to try to leave links like for Novitas so that you get those fact sheets as well. And that'll kind of help to kind of keep you in order when you're looking at these modifiers, and something to kind of help you to understand them, because there's other ones that I've put out before about modifiers that I thought were really helpful. And I know that the audience is growing. So a lot of my retro videos are coming back. Like, I'm like, that video is so old and people are still commenting on it. So it's good, you know, I'm glad. But it just goes to show you, when you put out information, you know, it may come back. So we'll see. But yes, December 1st, noon Central Standard Time, 1 o'clock on the East Coast, 10 o'clock on the West Coast. So that way you guys can get 25 days of modifiers. And I'm going to do a combination show where it's still like showing what the two modifiers together would look like, an example of that. And let's see. And then of course I'll still have my same show airing 5 nights a week at 7:30 p.m. Central Standard Time. Try not to overdose on on my show. I hope you guys don't get sick of me, which is always the worry whenever I have to do this. Whenever I do this in July and December is my 2 busiest months. These are the 2 busiest months that I have where I put out the most shows. But yeah, what's tomorrow's topic? Ooh. So tomorrow's topic, I have it written down. I think it is what to expect in the hiring process. Come on, no. I think it's what to expect in the hiring process. Sarah says, sweet, thanks again. See you on the 1st. I do have school, but I'll try to listen then. This is extremely helpful right now. You rock all. Thank you for all the blue hearts. But yes, that is tomorrow's show, which is, sorry. What to expect in the hiring process. Yes, as a medical coder. I get a lot of questions about like the hiring process. Like, do they do a background check? You know, what are some of the things that they're going to do? What do they ask you when you are like in the hiring process? So we're going to talk about that tomorrow. But yeah, that's tomorrow's show. CB says great. All right. So does anybody else have any other questions about the book? This was a great review, at least I think so. I would have thought a little bit more questions though. That's okay. At least we got some questions in. And I shared a few things that I saw in this book that I liked. But I would encourage you guys to continue to study in it And even if you find things wrong in it, it's still okay because it's still teaching you that critical thinking. You know, when I saw some of the, have you read the negative stuff on AAPC? Sorry, I didn't get my book. It's fine. What negative stuff? About the book? CB? They're all complaining about how hard it is to find work. It's sad. I'm surprised it's on there. Oh, okay. Okay, so here's the thing. Since we're done with this for the night, when it comes to people complaining, a lot of people complaining, it's hard to find a job. Yes, know all about the hiring process. Okay, so they're going to complain that it's hard to find a job because of the simple fact that you know, there's an expression among nurses. This is nurses eat their young. It's the same thing with medical coders. Now, what does this mean? It means that medical coders will not coddle other medical coders, other brand new medical coders. They're going to make you sink or swim. And that is what they do, unfortunately. So when you find a very supportive, very kind one, hello, okay, you know, hang on. Because this is the straight talk, okay? This is not going to be handed to you. These jobs, you got to work for them. And a lot of times what happens is, I was commenting since you mentioned the topic for tomorrow, but I'm just going to say this though, because tomorrow's topic is about getting hired and that part. But for this part, you know, people expect that it's going to be easy because that's what their recruiter told them. Oh yeah, it's going to be easy for you to find a job. You'll be able to work at home and yada, yada, yada. But what happens is when you see that people don't know their anatomy, medical terminology, and then they put even less effort into their resume and their cover letter, guys, the field doesn't know what you were trained in. Every medical coding program is different. And the people who complain the loudest are the people who are complaining. You're spending so much time complaining about not being able to find a job. That is because you have that already fixed in your head. Everybody knows it's a challenge when you're getting in. Everybody knows that. And if you didn't know it before, well, you know it now. And if you've been watching the channel or you've seen a lot of my videos, you know that there's alternative things that you have to do, like applying with the temp agency. And a lot of people will turn their nose up at that. Okay, I'm a veteran coder who went through a temp agency herself, got not one but 2 jobs, got not 1, not 2, but 3 raises in the same year. So, and that was because I started in the temp agency. So I know a thing or two when it comes to sharing this information. I'm not trying to hide information from anybody. So this is why I say, stay away from the negative people. Stay away. When you hear people complaining and going on, get out of there. When I see people on LinkedIn complaining, I'm like, you know, you're making yourself look like a fool because you're complaining in front of your coworkers, people that you want to be in this industry. Okay, then you need to have a more positive attitude, because the only ones that I've seen who got a job were the ones with a positive attitude. Well, I applied to 25 places, but I'm going to keep on going. And that same person was the person that got a job. And it wasn't long after that. But you got to have a good attitude. This is not going to be handed to you, and it is not easy. And that's the misconception that a lot of people come in to medical coding with. So if that was you, please look at all the alternative options that you have. And don't get mad when somebody tries to help you and tell you what the truth is and what you have to do, or what are some of the other options. It may not be what you want, but it's what's going to help you. It goes back to like when you didn't want to listen to your parents when they tell you to put socks on your feet, otherwise you're going to get sick. What happened? You end up getting sick, right? If you listen, put your socks on, you would have been all right. I'm just saying. So, but yeah, that's what I would say. When I see people complaining that it's so hard to get in and they want to give up and, you know, they've always failed. I saw that, and I'll never forget that one from LinkedIn. Oh, I've always failed at life. Well, if you turned around that attitude and you looked at your resume, you started applying at other places, and you started, like, you know, talking like a coder and thinking like a coder, then you'd be all right. But what a lot of people won't admit is that they can't pass a basic skills assessment test either. So that's another one. So that could possibly be part of it too. But hopefully I'll stay on subject tomorrow with what to expect in the hiring process. So we'll see. But yeah. So hopefully that answers your question. But yes, I would stay away from those, which is why I always tell you guys to stay out of those Facebook medical coding groups, even though I now have one. But bye, Alani. Thanks for tuning in. All right. So with that said, I hope you all enjoyed this. I hope you all continue to study your book. If you have any questions, let me know. You can leave them down in the comments. All right, good. I'm glad, CB. All right, so we're going to go ahead and wrap this one up. Thank you guys so much for joining me. I hope that you hit that subscribe button. If you haven't already, like this, share this, and I will see y'all tomorrow. Bye.